If for whatever reason you or we are worried about the possibility of an infected hip or knee replacement, we will follow certain steps. Usually the first step is blood work to see if the body is reacting towards a major infection. If the blood work is abnormal, or if the blood work is maybe borderline and pain is ongoing, maybe we will repeat x-rays of the involved joint, or more likely pursue a bone scan, a nuclear medicine study looking at the activity of bone around the replacement. If the bone is highly reactive, that could mean an infection. Of course, it could mean other things, but again, we're trying to use all available evidence. If we're still worried about an infection after blood work or x-rays or a bone scan, the next step is sampling the fluid around the involved joint. And that usually means a needle into the hip or the knee, draining the fluid out and sending it to the lab to see if there's any bacterial growth. Now, if we find gross pus in the joint with the needle aspiration, we may be going to the operating room within the next 12 to 24 hours. If the cultures come back positive within the next few days, usually we'll be talking about surgery over the next week. If the cultures are negative, and it may take 2 to 4 weeks before we know for sure if they are negative, but if they are negative and the pain is ongoing, we might need to think about further surgery. The necessary surgery for an infected total hip or total knee replacement is what we usually describe as a two-stage revision. The first stage being taking all the parts out and putting in a temporary spacer, sort of like those bad small tires that are part of a new car these days. It'll get you around town. It's not great. And then after the infection is confirmed and under control, 2 to 3 months later, we can think about replacing with the full scale, as we say, definitive replacement. Unfortunately, there is no way to know ahead of time whether an infection will require 2 months of treatment, 3 months of treatment, 6 months. Sometimes we have to repeat the first stage of parts out, clean up, wash out the infection, and then IV antibiotics for another 4 to 6 weeks. Typically, we'll have patients off of antibiotics for about a month before doing the second stage operation, or the definitive replacement. This is serious stuff. It doesn't happen very often, but just often enough. And we think that you need to know what can or might happen so that you can make a better decision for yourself as to whether to undergo replacement surgery in the first place.